Everyone. Thanks for being here. Um, we will go ahead and get started. I just want to welcome you all to Resilient Georgia's May Lunch and Learn. Just a reminder that our Lunch and Learns are recorded and they'll be posted on our website following the meeting today. And all follow-up resources and materials will be sent in a follow-up email afterwards. I'm excited to introduce Dr. John McElveen, who is the director of the Georgia Agricultural Wellness Alliance at the Georgia Rural Health Innovation Center at Mercer University. John is a former architect and transitioned to higher ed, serving as Associate VP for Student Affairs and Dean of Students at Columbus State University, where he established the CSU Care Team Network to support student mental health. Now he works statewide to improve health, safety, and well-being of Georgia's agricultural communities. And now I'm pleased to hand it over to John to talk to us more about stress and mental health in the Georgia agricultural community.
Thank you, Alex, and welcome everyone. This is such a privilege because I know you're out there doing the work in this mental health and wellness space every day. And to be able to kind of bring some of the conversations into that space about agricultural mental health and well-being, and some of the things that our farmers are up against and what we're trying to do with the Alliance. So we hope this will lead to some interest in your areas and some opportunities to partner with you on the local level. So just a little more about my background. I did grow up on a row crop and livestock operation farm in Bullock County, Georgia, a farm that my brother still farms. My dad farmed it before. My brother still farms and has expanded that farm and is still involved in farming. So while my professional path was not in agriculture, it is home for me. It is part of my being, and to be able to give back to this group is so important to me. So we're going to talk about farm stress. We're going to talk about some important data. We're going to talk about what's come out of those studies of that community and some of the sources of farm stress, because that's something, if you're not involved in farming, you probably only can guess some of what really impacts the health and well-being of our farmers and our farm families and the farm workers. So we want to talk about that, and then we want to talk about the Alliance a little bit and kind of what our model is and how we work and what we can bring to the table, which will overlap with a lot of what you're doing. So there was a survey out of the Georgia Rural Health Innovation Center at Mercer School of Medicine and the Georgia Foundation for Agriculture. As Alex said, I'm based out of the Rural Health Innovation Center at Mercer. This survey, it was the biggest survey that I know of that I've been able to find in terms of the number of participants. There were participants from all except 2 counties in Georgia, and everybody knows that Georgia has 1 billion counties. So there only 2 didn't have participants from that. So it's over 1,650 farmers, farm spouses, farm managers, and farm workers from all regions of the state. And when I first saw the results of this study, when I was looking at this position and applying to become the first director of the Alliance, this hit me between the eyes. And there were things, even though I'm from within that ag community and had worked in particularly student mental health areas and military veteran mental health, it still shocked me. And I think if you could shock me, who's worked in this space, and I think that's true of a lot of mental health professionals, when they saw this, they were stunned. The first thing these participants told us, 29% of them reported thinking about suicide at least once a month. 29%. When you started to break this down in this study, which I will show you a link to, this study, it did a really good job of breaking down these populations. first generation farmers. I came from a generational farm. You know, my brother farmed, my dad farmed, my grandfather farmed. First generation farmers, that figure rose to 46%. And almost 60% of those first generation farmers thought about it in the last 12 months, almost 60%. And so, you know, when I thought about that, it kind of made sense because they don't have that family framework, that support, those mitigating factors, the assets, the land, all that sort of thing. They have to start from scratch. So it's very important. And one of the things that we do is we really do some focus on first generation farmers to try and connect them with folks that have more experience that can help and talk with them. Almost half reported experiencing loneliness, sadness, and depression at least once a month, and almost 40% reported hopelessness each and every month. I just think these are stunning, and 60% reported lack of access to basic medical care, and 50% reported not having health insurance of any kind. So, and those figures skew some when you start to look at, and they're in that study, from farm workers to farm owners. Certainly, farm workers have less access to that sort of thing. But I think if you're from a rural area of the state, you probably are aware that one of the big challenges is not only that emotional isolation, but geographic isolation and access to healthcare. That is a big deal. Because if you can get a farmer to take an hour off, you're doing great. Okay. During their busy season and that sort of thing, if that care provider is an hour away and they're going to spend 2 hours in that office and spend an hour coming back, that's half their day. Most of them aren't going to do it. And so we're really trying to work on ways to get more access to that. And so these results were published through the Rural Health Innovation Center and the Georgia Foundation of Agriculture. And you can go to our website. You're going to see my little website banner that's down there to the right, georgiafarmstress.org. Under the tab Our Reason, there is a link to that study. It's 57 pages, I think. Great executive summary, great breakdown by different groups, ages, demographics, all of that. I encourage you to go and look at that, because there's so many more statistics that are important for us to learn about there. So let's talk about some of the sources of farm stress. Weather. Everybody knows about Hurricane Helene in Georgia, right? In the Carolinas. Huge impact, over $2 billion worth of impact on Georgia farms. So that was, we've seen hurricane after hurricane, starting with Michael in 2018, that had a huge impact on agriculture, particularly in the southwest corner of the state. Hurricane Idalia, Hurricane Helene, all of these have had huge impacts. Farming is one of the things, when you think about what it costs for them to put their seeds in the ground, the fuel, compared to the commodity prices, you could have all the weather, do everything right. You could do everything when you needed to and how you needed to do it. You could have a great year. And then let's say you're a peanut farmer and India has a great peanut year, or China has a great peanut year, or Brazil has a great cotton year. The prices will be depressed. So that is a huge, huge stressor. You can do everything right and still have a non-profitable year. So those unexpected financial impacts from whatever, whether it's cost of equipment, cost of fuel, these fluctuations in those input costs can really have an impact. Taxes, all of that. Succession planning and retirement, something that you don't think a lot about, but I know this has been a huge stressor on my brother, because he built up our family farm and expanded it with the idea that one of his children or both of his children would maybe take that over. But yet they've chosen, and he's fine with that. They've chosen different professional paths. but it's created a lot of pressure on him because he built that farm up, took some debt on and that sort of thing. And now he's trying to figure out, and he's a bit older than I am. So he's trying to figure out, how do I exit that? Physical safety. So many accidents on the farm. It is a dangerous profession. Insurance and healthcare access, as we mentioned before, pretty hard. The isolation, it is tough. Crop and animal diseases and damage. Everybody, all of our consumers know about egg prices and have probably heard about the impact of avian flu on that. I was doing a presentation with Jennifer Dunn of DBHDD, and also Steve Brinson from Department of Ag was supposed to join us in a presentation in January at the coast at the Georgia Young Farmers Convention. Steve called me halfway down and he said, "John, I can't make it. I've just gotten a call. I've got to turn back and go up to Northeast Georgia because there's been an outbreak of avian flu on a farm, and we're going to have to go and depopulate that whole farm." Now, that impact upon those folks that have to do that, the farmer who has just lost the source of his livelihood in one day, basically, it's huge. And so those providers like veterinarians and all for the state that have to take part in that, we're actually focusing on them next month in our Georgia Healthy Farmer Mindset during Veterinarian Appreciation Week. So, and this is a big one. You've got that generational farm, some of them like 6 generations. What if I'm the one that finally screws up and loses that farm? And that's the way they look at it. Even though they've done everything they can right, they can lose that farm. And that is a huge, huge cultural and family and emotional impact. So who are we talking about? And again, some of this is going to be preaching to the choir, but I want you to know what my message is when I go out into those communities. These statistics that we talked about, they're about our neighbors, they're about our friends, they're about our family members, and they are definitely about someone in your community you know. They may not tell you, obviously. And how do we make this better? This is definitely my preaching to the choir part, but again, I want you to know what our message is. We want to normalize that conversation. We want people to understand mental health is health, and I'm sure you've used that mantra too to encourage that conversation. And we're starting to see some traction even among the older generations in the ag community that are acknowledging it is health and we've got to talk about it. So I think we're starting to make some inroads, not just us. This message is going out in the ag communities all over the nation. We want to provide more training and information to lessen the chance of self-harm. We want to help identify care resources and how to connect others to resources. So things like 988 and other and providers in that local area. We want to help connect folks in those communities that let them know there is help for them. And we want to build collaborations with existing efforts, programs, coalitions, organizations like yours. We want to stand up alongside of you and make ag part of that conversation and make sure that's a two-way dialogue. We want that people within the ag community to understand about the resources that you can help with, and we want to help you as we do things like this, bring ag into that conversation so that you're better equipped to work within that ag community and feel more confidence in helping them because you understand more of what's there. And so we do want to create those partnerships. Let me just talk briefly about, oops. Sorry, I have an overactive mouse. Okay, so after the study came out, these organizations, the Rural Health Innovation Center at Mercer, Georgia Department of Agriculture, Department of Behavioral Health and Developmental Disabilities, Foundation for Agriculture, Georgia Farm Bureau, University of Georgia, all got together and said, we got to do something about this, right? We need to do this. And they said, what they did after a lot of discussions was form the Georgia Agricultural Wellness Alliance. Our mission is to foster networks of well-being in those ag communities, and we do that through collaboration, education, research, and advocacy. And our vision is a thriving, healthy, and safe agricultural community. So I want you to first focus on this right hand, our model here. In around our farm families, there are people that they trust and people that they need to be aware of that they need to trust. And that includes care providers, faith leaders, agribusiness people, local coalition services, organizations, education and research. We want those farm families to be surrounded with folks that are ever more knowledgeable about what they're up against. And we want them to know that those folks are there for them in their communities to help them. So what are we hoping to bring to the community as we set up sort of local organizations that maybe several times a year bring this conversation to the forefront? We want to again stand up alongside existing organizations like yours. We want to normalize the conversation. I know that Resilient Georgia has done some things with CRIM training, the community resiliency model. I'm provisionally certified in that. Several people at the Rural Health Innovation Center are fully certified. So we want to help with stress management. We can do, some of the standard suicide prevention trainings like QBR, mental health first aid. And we're really excited about something we're looking to bring into Georgia that came out of the Midwest ag community called COMET. It's changing our mental and emotional trajectory training. And it is a very simple training that is designed to help members of the ag community understand how to get past, how are you doing? I'm fine. And it really kind of gives them some simple steps and questions and helps them understand you're not being invasive, you're showing care, and you might be saving a life by doing this, and then helping them understand how to connect that person to resources. So we think that's very, very promising, and we're looking, our partners at Georgia Foundation for Agriculture, Georgia Farm Bureau are looking at sponsoring that coming into Georgia. And so we're looking at a train the trainer thing, hopefully very soon. And then I just want to mention we have a monthly Zoom that I've mentioned previously. It's on the second Friday of every month at 10 a.m. It is no more than an hour. And each month we focus on a different topic connected to rural and ag communities. So you'll see some of the previous ones there where back in February, we did women's agriculture research and stress and mental health, part of which was based on the big study I just mentioned, Ann Montgomery from the Rural Health Innovation Center, and then also Dr. Anna Chayette from UGA, both presented on their work in women in agriculture and stress and mental health. We did a Georgia opioid crisis, some care resources and funding opportunities in April. And tomorrow, in fact, at 10 a.m., we're at the intersection of Mental Health Month and Military Appreciation Month. We're doing we're having some really great speakers talk about work with military veterans in agriculture. There's about 7,500 military veterans who are farmers in Georgia. And so we really, there's a lot of work done there because sometimes in the military veteran community, there's a high mental health impact and situation there. And so that intersection of two high impact background and professional background and work things can really have an impact. Another thing that we do is we help plan the Farm Stress Summit. Every year it was in Statesboro in March. Last year it was up in Jasper, and we move around each year. So look for that each March. And then I'm going to wrap it up here and just say I really appreciate this opportunity to talk with you and engage with you about stress and mental health in the Georgia's ag community. And again, I would love to have further conversations. I hope that further conversations come from this, both on the state and the local level. And again, if you need someone to come talk to a group or to help bring in training and get more exposure within the ag community, we want to work with you on that. And we're happy to do that, and that will help fulfill our mission. So with that, I'm gonna turn it back over to Alex and open it up for any questions.
Thank you so much, John. It's amazing the work that y'all are doing and all the collaboration that's happening between all the different entities that have formed the Agricultural Alliance. But yeah, we really would love to open this up for anyone that has any questions, comments, ideas of how to, help farmers and ag workers in your communities.
Can I put one more plug in, Alex?
Yeah, for sure.
The many questions that I know they have. Just as a plug and kind of examples of kind of some of the local work that we're doing, I'm hoping to have a sort of a organizational discussion up in the Walker County area. When I'm back up there doing, I mentioned I did a young farmers group up there, and the response from that was so great. That I was asked to come back and talk to the Rotary Club in Lafayette. But during that time, around the 16th or 17th of next month, I'm hoping to be back up in that area and working with some of the folks that express interest to kind of gauge needs and talk about forming a group. So if you are in that area, that Walker County area, and you're interested in being a part of that discussion around the middle of June, please let me know and reach out to me. You can see my email address there, and then again, our website contact.
Thank you. We do have a question in the chat. Kamisha asked, is the comment workshop available for other sectors outside of the farming and ag community?
Yeah, and I will say we sat through actually the folks who were over that did a sort of special session for the Alliance Advisory Council recently, or those that could attend, and I think it's very applicable. Okay, it like I said, we love that it came out of the ag community and recognizes that that sort of reticence that's sort of built into that culture to discuss it. But I think it's very very applicable when I do talks and discussions with groups. One of the things that I always ask them is, what would keep you from talking to a friend or neighbor about whom you're concerned? You're really worried about them because you haven't seen them at the Friday night football games, and they always used to be there, or at church, or at the young farmers meeting. They've just kind of dropped out, and you see them in the store and you ask them, hey, how are you doing? And kind of getting past that I'm fine, thing that you always get. It really does teach you. I think it's maybe 5 sort of questions or categories of questions that are I guess what's the word I'm looking for, are sort of steps. Sort of one, you do this, and then you kind of go here, and then you kind of go there. It's really pragmatic, and I think it's very applicable. So you can do a search on COMET training. There are some available online. I think the University of Minnesota College of Agriculture does one a month that's free, and you can sign up for. So yeah, look it up and sit in on that. And again, we're hoping to be sort of at the center of bringing that to Georgia. But yeah, I do think it is applicable.
Thank you, John, for explaining that a little bit further, because as you were explaining it earlier, it kind of dawned in my head because I'm in Gwinnett and we're very, very, very diverse. And it's a lot of populations here who aren't comfortable talking about mental health or just the concept with mental health in general. So I felt like that would be a good strategy to use for those populations who aren't comfortable to talk about those types of things. So I will definitely be looking it up for more information. So thank you.
Yeah, Kamisha, I think when I ask that question about what would keep you, they always say something like, well, I'm not an expert. Or what if I put the idea in their head? Or, what if I'm getting into their business?
Yeah,
It
that's a big
really
one.
provides a very pragmatic framework focused on getting past those sort of self that self-doubt and,
Mhm.
the, what if I do something wrong?
Yeah.
What if I screw this up? And it kind of gets past that and helps them understand they can be part of that person's, recovery and connection to resources.
Awesome. Thank you.
Yeah, great question.
Question? Can you hear me?
Oh, yes,
I
go
can.
ahead, Deborah.
Okay, I have a question. So, how do you, I think what you're doing is great, and I think a lot of these organizations that we have is great. They do great work, but my experience and in my community, how do we build trust? How do we build trust? And the people that, we are in contact with first, when we reach out for these resources, in my experience, and a lot of people in my community, they don't have great experience with these people. So we don't have a lot of trust in our area. So how do you build trust, and do you follow up? Do you go back and follow up to see how things are going, how they're handling people when they're coming in for help? How do you handle that? What do you do about situations like that?
Yeah, and Deborah, I think your experience is spot on with a lot of what we see out there in these communities, and especially in the rural areas. I mean, just one of the obstacles is the lack of care resources in that area. But you're absolutely right. So it's that we don't necessarily trust that. I mean, part of the, and I'm going to take this from a sort of macro level first. One of the things that we are trying to do is to work with providers and that sort of thing to help them understand the ag community and the rural community better, so that they don't say something that throws off. And again, I can speak from the sort of ag perspective, but I know this is, this kind of works with a lot of different populations. The provider doesn't say something to them when they do finally come in, like, or call in and say, oh, well, is your, what's, is farming stressful? I mean, that's something that we're trying to help them understand. So that's sort of sources of their stress and frustration. We're trying to help providers understand that so that they're better equipped. And by the way, AgriSafe, which is a national organization that works in this space. They do a lot of safety and mental health sort of focus. They do a lot, and one of the things that they do, and I think there's still some seats offered in Georgia, funded by the Georgia Department of Agriculture. They do a training that basically is a continuing ed training that helps providers get CEU credits. It's about a 6-hour training, so it is a commitment during one day, but helps them understand mental health in the ag community. So some of the things that we talked about, but it's much more in depth, but it is a CEU training. So for providers, that's a good option. But I think one of the things that we try to do is just make them aware of, look, there are folks that will talk to you confidentially and do care about this. And one of the things that we promote, because of the rural nature of it, really heavily, but I think it's applicable everywhere, is the 988 line, in terms of a initial resource, because what those folks on that other end are trying to do, and I think they've really improved their response time. There's usually no hold more than like 20 seconds. So that's one of the things we combine with the comment training, to say, look, you could take that person when they open, you get them to open up to you and say, listen, I'll get on the line with 988 with you, and then I'll let you talk to them and I'll back off on that. But they are trained to try and help them connect to resources in their community. So I don't think we can eliminate all of those sort of cultural, fully, all those sort of cultural obstacles sometimes to care, trust. But I think one of the ways to do that is to just create that dialogue and conversation between providers and folks who need help, and just keep plugging on that. But certainly, if I've got somebody that reaches out to me, I try to follow up with them periodically, and just let them know always that I'm there. And that's one of the big things in COMET training is they're saying you're not obligated to become that person's caregiver. You're not personally responsible for their care, but just letting them know that you're willing to have that conversation, you're willing to help them find help is so important. And they might not take you up on it today, but if you offer to say, hey, call me if you want to sit down, have coffee, talk, call me up anytime, that sort of thing, that might pay off in the future. And so that's one of the things they talk about.
All right, thank you.
Thank you, Deborah.
John, could you talk a little bit more about the Farm Stress Summit and, when that typically is and what y'all do during the summit?
Yeah, so it's a one-day sort of drive-in conference, and we tried to move it around the state. Like I said, this year it's typically most years, and I think we've kind of settled on March as the optimal time because we're trying to, which is difficult in a state as big as Georgia is, to find a time that some region isn't involved already in planning or that sort of thing. But we found that sort of early to mid-March is the optimal time to do it. And it involves, you think back to our model where we talked about the farm families, providers, the faith leaders, agency representatives, organizational advocacy, all of that, educators. We see all of those come to that summit each year. And so we do programming during that day. We do a couple of breakout sessions, and we have some really good speakers on the topic of and advocates taught that day. So we're really just trying to expose that particular region to this idea that it is okay to talk about it. There are folks that are working on it, and there are resources for them. So we do that every year, and we do that in conjunction with all of our GAWA partners that were mentioned before. We're actually looking at possibly as early as this November, trying to do a youth in ag version of that. So working with groups like 4-H and FFA. Again, one of the things that I am so encouraged about is so many of the 4-Hers and FFA members are now choosing to do the topic of mental health in agriculture and on the farm for their, like if they're competing in the public speaking competitions or writing essays and things like that, they're using that topic now. A number of them have. I was the winner of the FFA prepared public speaking for Georgia last year was a student from Irwin County, a FFA member who was going to compete, who did compete at the National FFA convention, and she was talking about farm stress and mental health. So I got the opportunity to sit down and help her prepare for that. But she was the #1 in Georgia last year, and is now a student at ABAC. So the conversation, of course, that younger generation really kind of gets it a little more. So we're looking at expanding to maybe a youth version of that Farm Stress Summit. So if you look at any of our partners' websites around January, we're starting to plan next year's in June. So we'll meet monthly and talk about that. Location wise, I think we'll either be in Southwest Georgia or Middle Georgia this next year. We're just kind of trying to rotate it around the state. And so, yeah, it just, if you want to learn a little more about agriculture, mental health and stress, and people who are working with that and advocating for it, that is a great, great place to go to. One of the connections, the Georgia Licensed Practical Professional Counselors Association made a connection there with their incoming president, who came to that and she's a multifaceted counselor from Clio, Georgia, down in Southeast Georgia. But her name's Tracy Pace. She is also a farmer. Has goats and some other agriculture. She and her husband do some farming. So she was very interested in that. And I'm speaking to their state convention at the end of this month, and then doing their Middle Georgia Region Lunch and Learn next month. So these kind of connections, I think, are just, they're wonderful. And I think sometimes they can start at things like the Stress Summit.
It's great. Well, Susan and Valdosta said that they would love to host the Farm Stress Summit there.
Well, Susan, I think Valdosta has actually been brought up as a possible host. I think Jennifer Dunn at DBHDD, and working with their community service board, I forget which one it is, in that area, they kind of talked about that as a possibility. So Susan, you may get your wish on that.
Yeah, Legacy Behavioral Health is their CSB over there.
Yes. Yeah, Legacy. And actually the first event that I attended, even before I started this role, was something that was hosted by Legacy. It was like an area, I think it was a continuing ed thing, not for me, but I attended that there at the convention center. I think it was about 10 days before I started officially in this role and officially retired from the university system.
That's awesome.
I love it. I feel like all the connections are happening in real time. I love, John, so many things that you shared, but the GAWA local area model, I love like how you map out all the different groups that farm families trust or can trust.
Mm-hmm.
One of them was local coalitions, and I know one of your what you can do next is to invite a speaker from GAWA to a local coalition or an event. So I just want to uplift that for folks if you are planning a coalition meeting or a local event please reach out to John and GAWA, because they can share this really valuable information at that venue as well. And I also love the 4-H story that you shared, and how you're gonna really build out this youth work. And that brought up a question for me was, some of our coalition leaders here are in the Metro Atlanta area. So is there a way that they could also use this information? I know that they have local 4-H clubs as well. So just wanted to ask that question about how can Metro Atlanta leaders also be a part of this?
Yeah, Audrey, that's a great question. Here's something that I didn't realize, being from Podunk, rural Georgia, and I live in Columbus now, but there are a lot of urban farmers in places like Fulton and Gwinnett and that sort of thing. So we really try to talk with groups. I mean, anybody from those growing herbs in their backyard to to commercial operations in the urban areas. It's happening more and more with more greenhouses, that sort of thing. And when I was at 2 weeks ago, I was at the state FFA convention where I was exhibiting and also helping with some judging. I talked to a ton of FFA, which, if you're not familiar with that, is Future Farmers of America, but they just say FFA now. Ton of chapters from urban Atlanta. So really, absolutely this information. And again, the core message here is mental health and well-being. And we do couch it and specialize in that sort of ag community, but it is not limited to that and absolutely can be extended beyond those kind of borders.
Wonderful. Does anyone else have anything that they'd like to ask or add before we hop off? All right. John, is there anything else that you'd like to touch on before we end the meeting?
Not at all. I mean, well, just I want to say again, thank you to all of you for what you do and this opportunity to talk with you about this aspect of mental health and stress. I do go all over the state. I'm based in Columbus, but I have been to every corner of the state and will go to talk to a group, sit down with folks, have discussions, do presentations. Any opportunity we get to further this conversation and normalize this conversation, that's what we're about. So if I can help you in your area and partner with you, please, please let me know. I'd like to do that. There is just one of me, so I'm sometimes I'm not. I can't schedule it for the next week or whatever. But if you'll give me lead time, we'll work something out. So thank you for those opportunities. I hope that a lot of you reach out and we'll find ways we can work together.
Thank you. I think Audrey actually did have one more question.
I do have
Yeah.
a question. I was wondering, John, if you could talk more about the topic of addictions and recovery in ag communities.
Yeah. So one of the things I want to highlight, and I think you all may know something about it, but the certified life specialist program that is spreading it throughout a lot of our hospitals now. The Rural Health Innovation Center is working a lot with the CWC Alliance to further that. I think that is so important because they are working. If you're not familiar with that, well, they're working with both physicians and patients to provide sort of alternatives to opioids. They start working with the patients and the doctors before procedures and work with them after. One of the things that they do, part of their thing is in fact the CRIM training. So they talk with them about working with the sort of being self-aware of that stress, and when they're out of their okay zone, how to get back into it. But they also talk about different medical sort of regimens and things like that are that. And the opioid crisis in rural Georgia, I think probably most of us know, has been a big deal. If you are particularly in a rural area, the Department of Behavioral Health administers the folks who run the opioid trust settlement, that funding that came through the federal settlement from the the Sacklers and that sort of thing. They are in May. They are doing their second round of funding requests. So I would encourage you to go there if your community has some needs and wants to work on the addressing the opioid crisis. They have some really great funding that is available, and they are specifically wanting more rural areas to apply for that because of the level of the crisis in the rural communities. That was our focus last month in the Healthy Farmer Mindset Zoom.
Great. Yeah, that's amazing work. The life care specialists is something we're also partnering on too with CWC. So we're so excited about all these partnerships. Does anyone else have anything that they'd like to ask John, or add? All right. Well, thank you again, John, for this presentation. It's so wonderful to hear about all the work going on in the farmer and ag community to promote mental wellness. So we appreciate you. And just reiterate again for everyone, if you joined a little bit later, there will be a recording of the full presentation on our website in the next few days. And I'll also be sending a follow-up email with John's slides and any resources that we shared during his presentation. But with that said, I hope everyone has a wonderful rest of their week, and thank you. Have a great day.
Thank you.
Thank you.
Thank you
Bye.
so much.